MU Healthcare Ask the Expert podcast. I am your host, the morning show host on Y107, Cosmo with MU Healthcare. We've got pediatric infectious disease specialist Christelle Ilboudo here on the podcast with us with some important info to try and keep you and your family safe this holiday season. I think wherever you're traveling, whether it's across town or anywhere you need to go, masking should still be very important as you're going out to the stores and then going to potentially see some loved ones. Absolutely.
Masking and keeping your distance if you can from people that you don't live with, and washing your hands, all are very important.
It seems like we still have to continue to remind, keep those habits that we've had from the beginning of this, going all the way back to March into April when it was just, nonstop. Wash your hands, wash your hands, wash your hands. That's got to be, especially now you're including now working with food and other things. It's just keep those washing your hands habits going.
Absolutely.
Now, a lot of times with the holidays, like we said, you may be traveling, you may be going to shop or going to visit into a community that doesn't require you to wear a mask. Why is it still so important to wear a mask there?
It's important to wear a mask because we now know that the masks do two things. They protect the people that we care about in case we happen to be sick, but they also protect us in case the people that we care about happen to be sick. So we know masks work, and we now know that they work both ways.
And we're seeing some of the smaller communities, unfortunately, some of their smaller hospitals are just overwhelmed with patients there, and now that's filtering into the MU Healthcare system and seeing a lot of very sick patients from some of the rural areas, and the masks can help avoid that quite a bit, I think.
Absolutely, that even if people get exposed with the masks on, the chances of getting sick is really low, and the chances of getting really sick is even lower.
Flu shots, still an important thing. I know normally that's kind of something, and we've talked to you over the years here on the radio station and on the podcast, usually kind of get into that October time. We're talking flu shots, but it's still not too late to get one and still very important.
Yes, because the flu can look just like COVID-19, and we know that several studies have shown us that people who get the flu shot are not likely to get the flu, and even if they get the flu, they're not likely to get very sick and need to come see us in the hospital.
So now let's talk vaccine here a little bit. There's obviously been some very, very good news over the last several weeks. Vaccine that's coming, it was tested at, what did they say initially, like 90% effective, then 95% effective. What's next with vaccine news? There's obviously a lot of clinical trials, but when are we looking at potentially seeing it for our community here?
I think the earliest they expect is late December, early January. They went through the first phases of getting some FDA approval for emergency use. They now have to go through the other regulatory process of the CDC approving it for use in mass. And then the drugs will have to be distributed, but it will be based on priority lists. So certain populations, certain people will be prioritized over others just based on the risks of getting disease.
Well, especially frontline workers, obviously a lot of your coworkers and those nurses and doctors in the hospitals, not just in the MU Health system, but first responders near the top of that list as well.
Absolutely, yes.
More on questions about the vaccine, too, at muhealth.org/coronavirus. Any advice to those listening to the podcast as far as traveling for the holidays?
I think it's being aware of where you're going, what's going on there, how are the community rates, being aware of how you're traveling, what's around you, making sure that you're keeping your distance, you're washing your hands, you're wearing your mask while you're traveling. And then the next one is looking at where you're going, the people that you're going to be around. Are they likely to get very sick? Should one of you in the party have coronavirus? And the other thing that I recommend is really thinking about your space. So distancing outdoor activities as much as possible. If not, opening windows, have good ventilation, and still staying at least 6 feet apart when we are indoors.
For more information, Dr. Ilboudo, fantastic. Thank you so much for all of your information today. Get on to the website, muhealth.org, and then /coronavirus.